Thank you. Thank you so much, Dr. Bansal, for the kind words of introduction. And thank you to Dr. Mahapatra for inviting me to speak today and for the excellent follow-up that he and his team have had throughout the planning of this conference. So thank you so much. May I request the IT team to put on the first slide? I had sent you the slides and hopefully, thank you, Nikita. Okay, so the topic that I was given today is apps and mobile tech for home care and rehab. And in the next 10 minutes that I have, I'm going to try and just give you a quick summary of where we stand today and where we would look to go in the future. Next, please.
Your turn.
So unfortunately, we can't, no, the previous one. Unfortunately, we can't meet each other in person these days, but this is just a picture of a hospital in South Mumbai. When things are more normal, please do come and visit. Next, please. So today I'll quickly just touch upon what is telehealth care, talk about telehealth applications in cardiology and some of the current devices and monitors used, try and spend more time on that and a few points in conclusion. Next, please. So, we were all aware of telehealth care and telemedicine. Frankly, we've been talking about it for the last, more than 2 decades. But it required a global life-changing event like COVID to really make it come into the forefront. I am sure that each and every one of you attending this conference today has significantly increased your telehealth practice over the last 1 year. And part of telehealth is also remote patient monitoring. Now, this is something, again, which we were doing in the past, but necessity is the mother of invention, and the last 12 months has accelerated the development of science and technology in this area. Next, please. So when I was given the topic, I went online and did a search for, articles related to it. And we looked at mobile apps for blood pressure monitoring. And I did this was a systematic review. Next, please. And I'm not going to go through, next slide, please. Yeah, I'm not going to go through this slide in detail, but honestly, the point is that a lot of this information is available out there. Now, what's very interesting is where blood pressure is concerned, at the end of the day, one of the most important aspects of blood pressure care is frankly measuring the blood pressure. So an app by itself cannot measure the blood pressure. You need a device to measure the blood pressure, and the device kind of talks to the app, and that makes the circle complete. Also, what's happened is there has been a plethora of devices that have taken place over the last 5 to 10 years, and especially over the last 1 year, which allows these kind of devices to measure, many different aspects of our health in all aspects of our body. Next, please. Can I have the next slide, please? Yeah. So, this, if you see on the left, this is actually a telehealth session we were conducting. So on the left is my doctor talking to the patient, and on the right you can see an ECG streaming. So if you just click on the slide, it's just a 5-second video. You'll see there. Yeah, you can see the ECG actually streaming. So we've been using a device which is called Fourth Frontier, and that is made in India. It's actually made in Bangalore. So it's very nice that we have an indigenous device. And for the first time, I've been monitoring this space, frankly, for the last 15 to 20 years. For the first time, I have personally come across a device which is both very convenient to use and at the same time has stability in ECG data. Next slide, please. Yeah. So the device literally is a chest strap, and I'm actually wearing it as we speak. Okay, I'm wearing it as we speak, and if you see my phone, my ECG is streaming live to on my screen as we speak. If obviously I could have reflect on the screen, but I'm not presenting from my laptop. But the ECG is reflecting live, and the nice part is that I can through WhatsApp send this ECG to Dr. Bansal or to anyone, frankly, across the world who has WhatsApp, and it will also stream live on them. So we're really able to measure and monitor patients very well because of it. Next, please. So, in person, when we're doing it, we're monitoring patients. For example, here I'm using the standard Philips monitor where we're using telemetry monitoring, and throughout the hospital we can measure, but this did not allow us to measure people at home. So with these new devices, we can actually measure people long distance and at home as well. Next, please. This was a lovely review in Nature Reviews, which I read just, I think, about 10 days ago, which spoke about smart wearable devices in cardiovascular care, where we are and how to move forward. Next, please. And it's a lovely article. I really recommend you read it, and goes into great detail with all the devices that are currently out there in the market, all the commercial devices that are currently out there in the market, and the studies that have been done and what they are used for. So just like a quick sort of roundup, they have devices which even they have medical earbuds. We've got ECG patches. We got a chest strap like the one I'm wearing. We got a smart watch and band. I've got a fit out here which does my heart rate data. Today, for example, Geo has come out with this new band. With this, it's giving me ECG, it's giving me SpO2, it's giving me body temperature. With COVID, body temperature has become a big thing. There's a company called Alive, which is the first one which tied up with Apple to give you a ECG for atrial fibrillation detection. And this is what the Alive Core sort of strip looks like. So if I just put my finger on this and I have on my cell phone, on my Apple phone, my ECG can be transmitted. Today you have a smart ring also which can do some of these things. And you have sensors which are even embedded in clothing, sensors embedded in shoes. We're measuring physical activity through accelerometer. We're measuring blood pressure. So it's all sorts of data that we're getting. Next, please. So this is the ring I was talking about. It's called an Aura ring. This is literally the size of a ring that someone wears around their finger. You can sleep in it. It gives you all sorts of sleep data. And this is Omron. So Omron has been one of the sort of leaders where this technology of blood pressure monitoring or digital blood pressure monitoring is concerned. And they came out with this watch, which is called a heart guide. And if you kind of look at that picture, you can see there's a cuff inside it. So the cuff kind of inflates and deflates on regular interval when you want to measure your blood pressure. Today, there are many devices which even work in a cuffless manner. Next, please. So Alive Core, one of the largest companies in this data monitoring, and Omron, they've kind of partnered together to do remote cardiovascular monitoring. Next, please. So, today there are more and more monitors and apps which are helping to increase convenience and accuracy while offering this continuous measurement. We know where blood pressure is concerned. You have things like white coat hypertension. The person comes to you and the pressure is high. They go home, it's normal. Also, the typical way that medicine is practiced, you'd go to your doctor, and they'll check your blood pressure reading, and they'll see you again after 2 weeks, 3 weeks, maybe a month, maybe 2 months. So essentially, we are taking calls on clinic measurements. You're seeing a person one time in 2 weeks, 3 weeks, 4 weeks, and making a call. And we all know that one pressure reading could be inaccurate, both on the high or wrong. So when I say inaccurate, I mean not fully representative. Next, please. They had a study which looked at BP measurement in the doctor's office versus BP measurement in the self-monitoring BP at home, both by a telemonitoring as well as just by sort of paper and pen monitoring. And what they essentially found is that regular self-monitoring at home and telemonitoring was better than just standard doctor visit monitoring of BP. And this was published in Lancet 3 years ago. Next, please. So what are some of the barriers for implementation? Okay, the last couple of slides, we'll talk about some of these barriers. One is just what we may call digital literacy. And that's changing rapidly. Today, the vaccines are being rolled out. To even get a vaccine, everybody needs to be digitally literate, or they need to have some family member who goes online. The COVID app is there. You need to log on. You need to register. I think one of the two big constraints I practically see in practice is that physicians are often inundated with so much in their practice. There's so many things going on that to kind of separately monitor people, monitor patients, and have that data come in tends to be an add-on burden. And I'm not sure a lot of these apps also don't tend to be very physician-friendly at the back end. They're user-friendly for the person using it, but often they end up giving the doctor so much data that the doctor spends time separating if I may call it, the noise from the data. Okay, when atrial fibrillation was starting detecting by the watch, so many people went saying they've got atrial fibrillation, and some of it, frankly, was noise as well. There's also an issue sometimes about the legality of some of these things, cross-border monitoring, ethics, privacy issues. So I think as the world is getting more digital, we are learning more about this, and we will get clarity over time. Next, please. So in the future, what are we envision a healthcare system that basically, yes. that assembles a broad spectrum of patient data. Okay, this is parameters including movement, ECGs, lab tests, genomics into an electronic health record, which is then analyzed by an artificial intelligence algorithm. Okay, and now this data is made sense of, and I feel that this data should not directly go to the patient. It should go to a doctor's office who can review the data, but review it in a very meaningful manner, summarized manner, and it can then go onwards to the patient, which can really help take healthcare to the next level. I think behavior modification, we know things like medication adherence in blood pressure are huge issues that patients just don't take their medicine beyond a point in time. So medication adherence is a big issue, and some of the apps act as reminders, they act as motivational messages to take your medicines on time. Active smoking, so it can help you give messages regarding anti-smoking. Next, please. And like I said, all of this needs to be backed up by a human team of providers who review the data. Next, please. Okay, so in conclusion, basically, we know that telehealth technologies play a significant role in increasing access to healthcare and potentially reducing costs. Evidence supports the use of wearable devices. We need more large, well-designed trials to establish their advantages over what I call usual practice. Challenges include concern for device accuracy, patient privacy, cost, and sometimes how to separate actionable data from what we call noise. And some barriers include loss of personal touch. So I think the doctor must be involved as well as privacy and legal issues. Next slide, and this is my last slide. But this joke, I think, is relevant where the doctor is the patient's telling the doctor, I've already diagnosed myself on the internet. I'm only here for a second opinion. So while we don't want to be lost to technology, technology can certainly help us take practice to the next level. So thank you once again for your attention on this late Sunday afternoon. And thank you to the organizers for inviting me.